This is a download from BFM 89.9, the business station.
Good afternoon and welcome to the show. I'm Mira Sivasodi. In our Health and Living segment today, we're going to find out a little bit more about the private healthcare division at Institute Jantung Negara. Joining us, the head of operations from the private healthcare division, Dato Dr. Mohamed Ezani Taib, who happens also to be a senior consultant cardiothoracic surgeon. We're going to find out how he made that transition and where IJN is actually going with this new division. Welcome to the show, Dr. Ezani. How are you today?
I'm fine, thank you.
Tell me about yourself. I mean, you are a cardiothoracic surgeon. Obviously, being a senior consultant, you've been, a pretty senior person in that line. And then moving on to operations, what was that like for you?
Well, I've been a practicing surgeon for the last 24 years in IJN. Yeah. And actually, being in the management has been for the last 5-6 years. IJN is a physician-led hospital. It's important for clinicians to lead the hospital simply because we are supposed to know or feel better than the others. Mm-hmm. And the transition has been challenging initially, but we've had good training, exposure. And any of the physicians who are interested to pursue a management line will be trained in many ways. Firstly, of course, in finance, we are exposed to finance and human resource management, and then the basic administration and so on.
And what has been that experience like? Been like for you? And how long have you been doing this?
For the last 5-6 years.
Okay.
Yes, yeah.
Operations for 5-6 years.
That's right.
Okay.
But the IJN Private, this is a new venture that we are pursuing. IJN is a group of companies, not just the IJN Sanjana Berhad, but actually it consists of IJN Holdings, which has under it the IJN Sanjana Berhad, IJN College, IJN Private Healthcare Company, and IJN International. So there are a series of companies that are under IJN Holdings, and this new company, IJN Private, is geared towards for IJN to venture into the private healthcare market. We've been doing it internally within IJN Sanjana Berhad, but we realized that there are issues because there are still public perception that IJN is a totally government hospital.
Mm-hmm. Yep.
That's right. Yeah.
I was just about to tell you. I'll ask you because perception is that IJN is still government. So how will the private healthcare division make a difference to people who come to the government wing? Can I say that you have now a government wing and a private wing? Is that correct?
Well, yes and no. We hope that by 2021 we'll have a separate wing, but at the moment we have shared facilities. But we have separate wards for the private patient. That's on the 4th and 3rd floor. The 6th floor is where the private clinics are in the wellness center. So that's where the private patients are attended to. So that's separated from the rest of the government patients.
What would the difference be?
Well, I think once you reach the 6th floor, you realize that the ambience is different.
The artisan cafe and the beautiful lounge.
Yeah, perhaps. But I think, we want to project IJN Private as slightly different. If I can use the airline industry as an analogy, yeah. The main thing, why would you want to go to a hospital? Select a hospital. First of all, it's good reputation, safety, good results. Comfort, and of course the price. Yeah, so we realized that if you maintain the pilots or the doctors the same, that means they're flying you to the destination. So the only difference would be the class that you're in, first class, business class, or economy class. So that's what we're trying to make the difference. So everybody that goes to IJN, regardless whether they are government patients or private patients, will get the same treatment in terms of the skills of the doctor and the medication and also the facilities. That's why the shared services on the 1st floor, which is basically the heart of the hospital, the operating theatre, the CCU, ICU are all shared. There will be segregation or separation of the beds, obviously, but the standards and the equipments are all the same. So, there shouldn't be any concerns that, once if you're a government patient, you will not be given the same standards of care or the facilities and equipment. It's exactly the same. It's just that the wards will be different, of course. The private wards will be, better, nicer, things like that.
But fact remains, you are still part government.
Yes, that's right.
Okay, and how much government funding, how much will you generate from the private sector? How will that actually work?
I think we hope that by the 1st of August, inshallah, we will have a separate entity totally. So it's going to be IJN Private on its own and IJN Sdn Bhd on its own, which deals with the government patient. We don't get any funding from the government, actually. The IJN Sdn Bhd, it's pay for service. The more you do, the more government pays us. And the price has been fixed I think for the last 10 years, it's been the same.
What do you mean? I don't understand. Government pays you?
So for so say for example, we do a case today, then if it's a government patient or government-sponsored patient, the government will pay for the case. So that's how the government pays. They don't allocate an X amount of money for IJN to spend. So if we don't do, say for example, last year we did a total about 4,200 open heart surgeries, right? So we'll get X million ringgit, right? So if this year we decide to do only 3,000, we'll get X minus whatever is the less amount.
So what does that mean? If you're no longer a government patient, do you then now need to go to the 6th floor, or can you still go to the 1st floor if you are not a government patient?
Okay, let's put it in a different perspective. If you happen to be a roti canai seller, right? You don't have enough income, and if you require cardiac heart surgery or treatment for heart-related diseases, you can come to IJN provided that you get a referral from a government hospital. So once you get that referral, that will then activate the processes, because the government has stationed what we call the unit tafsiran under Ministry of Health that will assess the patient's financial background and decide whether they are entitled for a full government sponsorship or partial or depending, right? Then they will come to the government side of services.
Is there a delay because of that process? Or can it be streamlined better?
I think it, in fact, is very good actually. So, but usually the issue is whether the documentation has been complete. That's where the challenge is, because sometimes they come over and they request for certain documentations that they do not have when they come in. That would delay a bit of things. But in general, it's very good. The unit tafsiran does it very well, actually.
Do you just want to go back and give us a little bit of a brief history of IJN and when it actually was set up? 1982, was it?
No, 1992.
1992, I apologize.
1992. Yeah. So IJN, we moved from Hospital Kuala Lumpur in 1992, and then it was corporatized in 1993. Sorry, in the end of 1992. And
it's been 25 years this year, am I correct?
It's been 25 years, that's right. And it's been, when I remember, because I was just a junior medical officer then, and when we moved across from Hospital Kuala Lumpur to IJN, we had with us approximately about 8 to 10 years waiting list for open heart surgery.
8 to 10 years?
Exactly. And my task at that time as a junior doctor was to carry those we had 4 big books that would list down every single patient that was listed for cardiac surgery.
How many of them didn't even live to see the 10 years and get
I have no idea.
Heart bypass?
Yeah. But that's not just bypass, that's about patients with congenital heart disease,
everything,
and valve and so on and so forth. So from 1992 up to 2000, we were really pushing hard to finish off this waiting list. We worked really hard. The surgeons, the doctors, the nurses, extremely hard. And it was there was no opportunity to actually do private patients, or very little, because there was not enough the resources, one thing, and the beds were not enough. That's why in 2007 we embarked on an expansion program, and in 2009 we moved to the new block that you see now. That allowed us to actually pursue private patients. But even then, it was on a limited scale, and until as recent as only about 2-3 years ago, that's when we expanded actually more. I think the expansion to do private patients is important because that helps retain the doctors, obviously, and also the allied health services, because the pinching of staff is very common, not just within the country, even abroad. A lot of our nurses go to Saudi Arabia, Middle East, because obviously there are better prospects there.
Because we can't pay good well enough.
Exactly,
okay,
yeah.
All right. And so we'll come back and find out more about IJN and some of the services that they offer. They've got a new private healthcare division, a private wing, like we do know many other government hospitals have this private wing. What's taken you so long to actually come up with the private wing? A lot of other government hospitals have come up with this. We'll come back and find out more up next. And in terms of financing, what's actually actually available to people who want to opt to go to the private healthcare division? Because we do know in the normal IJN, St. John Berhad, you have access to EPF, you have access to insurance and things like that. How will that change if you seek help in the private healthcare division? That's coming up next on The Bigger Picture, BFM 89.9. Good afternoon and welcome to the show. I'm Mira Sivasodi. Joining me, Dato Dr. Mohamed Ezani Mohamed Taib, the head of operations of the private healthcare division and senior consultant cardiothoracic surgeon from Institute Jantung Negara, National Heart Institute, has just started this new division, and we're trying to find out a little bit more, getting to know IJN a little bit more. A lot of us take this, this hospital for granted. I think you always know anything. Yeah, heart problems, just go to IJN. But there's more to what's actually happening. It's been 25 years. How do you think, Dr. Ezani, and you've been there from almost day one, how has IJN evolved over the 25 years?
I think it's evolved from a single or two-department facility to a huge hospital that deals with, or its services ranges from the simple outpatient treatment to the most complex cardiovascular surgery or interventional. So it has really evolved a lot. And, in the past, as I said, I used to know every single staff because there are not many of us. Now there's about almost 2,000 personnel working in IJN. And the nursing division alone there's about 800 nurses. So you can imagine the amount of resources we put in taking care of our patients. There are 800 nurses for 450 bedded hospital. We have 100 critical care beds. And when I started in GHKL, there was only then, right, for cardiothoracic, there's only 6 beds for cardiac surgery. Now there's 100 beds. So IJN has evolved tremendously. But I think we cannot stop there because we want to offer services. We think that we have attained certain levels of standards. As you know, IJN has achieved multiple accreditation. The most important is the Joint Commission International. That's an American accreditation. This is our third accreditation, one of the most challenging accreditation within in the world. And IJN is the only government-linked hospital that has got that accreditation. There are, of course, other private hospitals that's got it, but not many. And we are the only dedicated heart center that in the country, of course, that has got the JCI accreditation. So those standards are extremely high, and it's not easy to achieve. We are expected to have many processes in place to make sure that the patient is safe, because patient safety is the main issue under accreditation. So we've got that, and I think once we have got there, we realize that we have certain skill sets that we should explore. And we realized that the patient pool should no longer be concentrated to cardiovascular diseases, because a lot of these patients have got other diseases related to the heart, obviously. For example, a kidney and the lungs. And so we are hoping inshallah next year we will be pursuing under the IJN Private. We'll have our own in-house nephrologists with maybe perhaps a 20-bedded hemodialysis unit for both inpatient and outpatient. So we're going to offer renal therapy or nephrology services to our patients. This for private patients, obviously. We want to expand the lung services. Now, cardiothoracic surgery means that for the surgeons, we operate on the lungs, not just the heart. Now, we've got also a visiting respiratory physician that treats the lungs. So we want to expand on asthma, sleep apnea. More importantly, is lung cancer. We actually one of the bigger hospitals that does a lot of lung cancer work. Personally, I do a lot of lung cancer work. In fact, the first minimally invasive pulmonary or lung resection, or what we call keyhole surgery, was done in IJN. This was a few years ago. So these are things that people are not aware of.
But how do you ensure you don't lose focus?
Focus on cardiac surgery?
Yes.
Or that's unlikely we'll lose focus.
National Heart Institute.
Because
everybody else, you can get facilities for everything else, but you've always been specialized with the heart. How do you not lose focus?
I don't think we would be able to lose focus, because the heart will remain the most important, or the focal point of where treatment will be. Because we treat last year alone to about almost 200,000 outpatients. So there is no way that you can take those patients away, obviously. But the focus remains in the heart, because that's our niche market. we've got surgeons that specialize in very, very sub-specialization areas, which are, people come to us for training. So to lose all those advantage points that we have, and also all those extras, is be a big mistake, I think. And, we have, like for me now, I have a trainee from Brunei that's on training for 6 years to become a consultant cardiac surgeon. We have trainees from Yemen, from Sudan, from Japan. So I don't think IJN wants to lose that, those levels of focus that you mentioned just now.
Okay. JCI accreditation is somewhat the gold standard, would you say, for hospitals, and you're the only heart institute that has it.
That's right, in the country.
In the country. What about governance, Dr. Ezani? You're a government-linked hospital.
Yes.
That's the first time I've heard of one, actually. A government-linked hospital. We always talk about government-linked companies. Governance. So who keeps an eye on, that everything is running, in terms of governance, that everything's in order? Who decides that?
There are two parts. There is the management committee consisting of the group CEO, the clinical heads of surgery, cardiology, anesthesia, and then obviously the managers or general managers in charge of finance and so on. We run the ship, basically, right? But being a hospital, we also have what we call a PAC, or Professional Advisory Committee, consisting of all the consultants within the hospital. And that's a requirement by law that you need to have that, the Private Medical Act. And so that is where, first of all, that's the group of doctors that will then look into the performance of the hospital. Okay. Besides that, we have a chief clinical officer who oversees the standards and results of all our activities. I can speak for cardiothoracic surgery. Every month we will have our mortality, morbidity discussion, and every single case needs to be cleared up by the department and verified whether was there an error or was there problems with the case, and that will then be seen by the CCO or the Chief Clinical Officer, who will decide whether further action needs to be taken or not. So standards are maintained that way. That's one. Secondly, we are proud to report our results online. So if you go to our IJN website, you will see some of our results of mortality with open heart surgery or procedures involving cardiology cases.
What about finances? Is that open to the public as well?
Yeah, of course. We are a Sendirian Berhad company.
Sure.
Yeah.
Okay, because, with government funding, with government paying you, that's taxpayers' money to a certain extent. Yeah, so that's great. Good to know governance.
I just want to add on that. In 2007 or 2008, the government allocated 30 million for us to pursue the mechanical heart and transplant program in the country. And that was just supposed to last us for 5 years. Yeah, they said, okay, you spend for 5 years to do this. But I think we were very prudent, and we made sure that we do not just spend, for whatever it is, and we managed to sustain that 30 million for almost 10 years. So that was very good. So that means we managed to treat more patients. We were able to do more things, and So one thing about IJN, I would say, is that we've been very careful with money. Our finance department always chasing after us if the cost goes up, And at the same time, actually, Mira, I lead the cost optimization task force in IJN. And this is the first time that the hospital has gone into this area. This was about 2 years ago, and I'm proud to say that for the task force, we have managed to come out with savings involving consignment and drugs to items to amounting to more than 30 million ringgit. We've managed to cut down prices. So we've been working hard to reduce costs also,
Over the past, 30 million over the past?
30 million over the last 2 years.
Over the past 2 years.
So we managed to cut down a lot of things. I won't say wastages, but we've been improving in our processes and making sure that the way we look at consignment items, we've been trying to be a more lean hospital so that our inventories do not overflow. So that we've been good.
Okay. The private division, let's come back to that, the private healthcare division at IJN. How will people be able to afford this? I mean, is it going to be through insurance? Will the same sort of principles apply in that I can go to EPF and withdraw some of that money? Will that still be the same?
Yeah, it's exactly the same. Basically, we used to have a private clinic on the ground floor. We've just moved all of that out to the 6th floor. So whatever facilities that was in the past just continues on the 6th floor. Patients are still able to use, if they have cash, they want to use their EPF, insurance, government, company GLs, or whichever form of money that they have, we will accept.
How do you manage the separation between private and public sector funds and healthcare? I mean, there are two divisions, obviously. How do you make that distinction in how you manage, whether it's operations, whether it's finance? Is there or does it not make a difference?
No, of course it makes a difference. What happens is that, there are 4 parts to the operating model or business model of IJN Sdn Bhd, which is, first of all, there's shared services, which means that we share certain parts of the hospital together. And then there's buy services, then we buy from IJN Sdn Bhd. Say, for example, the operating theatre. So I would buy, say, for example, like today, 8 hours of operating time. That includes facilities, manpower, and whatever comes with the operating theatre. So that process will go in. Thirdly, there would be dedicated services. That means IJN Private will own that part of the hospital, right? Or either lease or rent, own, lease or rent. And we will actually then run that place has IJN Private's owned area. And there would be the last part would be the rental of some of the facilities that we have.
Okay, and what if I come in as a private patient and decide that I can't afford it and I want to go back to the government? Is that possible?
Well, it is possible, but there would be I would say it's going to be a bit of a challenge, because it depends. If you've been a private patient from the very start, then if you want to go to the government side, the challenge would be actually because the government's ruling is that you need to get a referral from a government hospital. So which means that technically you need to be discharged from IJN Private and be seen in the government hospital and get a referral. That's how that's the process that's been set by the Ministry of Health.
Okay, and even if it is moving to the government wing of IJN itself.
Yes.
Okay, what about the other way around? If I want to opt from government to move into private?
That should not be a problem.
Not a problem at all.
So obviously, provided you have the funds to.
Yep. Why is it a problem to move the other way around?
From private?
Why is it more work? To move from private to government.
Okay, I think one of the things that the Ministry of Health has put in place is to make sure that there's no abuse of services within IJN, and I think the Ministry of Health have got wonderful centres on their own, based in Serdang, in Penang, and Johor Bahru. So they obviously want to make sure that those centres are utilised to the maximum. So in patients who are government servants or patients who are poor, they would prefer the patients to be treated there unless those centres are not able to cope. And we see that actually the government centres are also not able to cope because there are just too many patients. You can, as I said, from our statistics, I know that about 70,000 of our outpatients are from Klang Valley alone. There is no way you can take 70,000 and send them to GH or something. They won't be able to cope. So so we are able to cope because we have the numbers and of doctors and staffing to do that.
I mean, heart disease is the leading cause of death in Malaysia, both amongst females and males. It's not going to get any better.
Yeah.
It doesn't look like it is.
It will not.
We're really heading in the wrong direction.
We are.
Do you ever think you'll be able to cope?
I think being as Malaysia gets more and more affluent, we will face that challenge throughout for the many, many years. I was just reviewing our data from the wellness centre. About 5 to 10% of patients that come in who are coming in healthy actually have a heart problem. That's a lot of patients, 5 to 10%. You actually do not know that you have got a problem. You come in and you do the screening and realize that you've got blocked valve, blocked vessels, some form of heart disease that requires further intervention. This is really scary. 10%. You just mentioned 1 out of 10 people walking here actually have got a heart disease without them knowing. So that's why we encourage health screening and this wellness program for those who have associated risk factors. those that have got strong family history, those that already have got comorbid factors like diabetes, hypertension, high cholesterol. And of course, if Malaysia is well known to be the most obese country in the region, so that it doesn't help. Unfortunately, our lifestyle have changed so much, and it's sad to see that as much as we have progressed from the economic point of view, but from the health point of view, we are going down a bit.
I'm going to digress a little bit from IJN and move into your area of specialty. And there seems to be a lesser need for open heart surgery. And as a cardiothoracic surgeon, do you see yourself being irrelevant at some stage?
Out of job?
Yeah. Well, lucky you're in management. You can hold on to that.
True. No, it's true. I mean,
you planned it well.
It's true. I mean, if you look at, in fact, I was just telling my trainee yesterday because we did a hole in the heart yesterday, in congenital heart. I was just saying that, when I was training, we used to do hundreds of this. And now all these are done by the cardiologists by just using wires or interventional. So there will be cases in which the cardiologists will take over, and there's been a number of those cases. And there have been ballooning, stenting, blockage, arteries and things like that. But there will still be a big group of patients that require surgery, because not all cases can be treated by medicine or by this wires or catheter-based treatment. I don't think it will be irrelevant, but certainly surgeons would need to change, or else, as we know, dinosaurs will just disappear.
Yep.
So for us, for me and for my colleagues, we've embarked in quite a bit of new services. For example, minimally invasive cardiac surgery. That's I take that one of the things that I do. Minimally invasive.
You can actually do that?
Yeah, so we have a
without
3-inch incision just under the breast and do a complete bypass. Yeah.
Wow. Without actually,
splitting the
sternum, exactly.
And without going on the heart-lung machine. Yeah. Wow. We do that, and as I said, we've done for the lungs and thoracic work. We do for the valves. You can make a small cut here and actually replace a valve. But this is not for everybody. Technology is advancing, certainly, and they will reach a stage when it gets much easier. But now it is challenging, but we're able to do it. So surgeons must remain relevant by actually going towards, new things. You cannot be stationary.
For sure. And the lung as well is a special interest of yours.
Yes.
Okay.
It's a challenging because the lungs, it's not as kind as the heart. Because the lung, as people might not realize, the lungs tend to bleed more than the heart. So if you do not do the surgery correctly, you're going to have a lungs that's bleeding. And the worst thing, when it bleeds, the patient will be drowning in his own blood. Mm-hmm. So having a person that can do lung surgery properly is very important.
And this would be for what conditions?
For lung cancer, for infection of the lung, for tumours in the lung which are non-cancerous, but they're just growth. And of course, patients with chronic obstructive lung disease, or smoker's lungs we call it, they have those problems.
COPD.
Yeah, that's right.
Okay. Your message, or what would you like to fill us in on the future for IJN in terms of government as well as the private healthcare division?
I think first, for the government patients, I think there shouldn't be any worries of concern that IJN would not be looking after the government patients. I think that's not true. 80%, I would say almost 90% of my work is government patients. We have business rules set in place that would not allow doctors to concentrate more in private patients rather than government patients. So that's I think business rules that are in place and monitored closely. In fact, there's a monthly statistics on that, so we make sure that everybody follows the rules. For the private patient, I think these are exciting times because this is going to be a new healthcare center that's going to offer services beyond cardiac excellence. That's our motto anyway, beyond cardiac excellence. So we're talking not just about the heart, we're talking about the lungs, the peripheral vessels, the kidneys, endocrine, which is diabetes, thyroid problems, and we're looking at vascular surgery. So things are exciting in the future.
Fantastic. All the best to
Thank
you
you.
and the team.
Thank you
That
so
was
much.
Dato Dr. Mohamed Ezani, Mohamed Taib, Head of Operations of the IJN Private Healthcare Division, also a Senior Consultant Cardiothoracic Surgeon on The Bigger Picture, BFM 89.9.